this is Dr. Galvez again, and I just wanted to check on you and see that everybody's doing okay. I hope that you guys are all safe at home and helping flatten this curve. There are so many things we can't control nowadays, but there's definitely some that we can. And I think that by doing so, we're going to get back that feeling of we're getting out of this and we're doing it together. So one of the things that I can help you with is to teach you how to do proper oral hygiene. A lot of people ask me, what do you do first? What is it that I should do first? Or what kind of floss is better? What toothpaste or toothbrush you use? So first I want to say something. Many people that come to my office tell me, doctor, I have terrible teeth. My mom had bad teeth, my grandma had bad teeth. I mean, this is just a long line of like a family thing that we all have terrible teeth, and that's why I have so many cavities or gum issues. And while yes, genetic has some input in our oral health, definitely what has a great impact is what we do at home and the way we manage our appointments at our dental office, being that Beautiful Smiles where I'm servicing all of you, or any other office that you may go to if you are just watching and you are not yet part of our family. Anyway, so what to do first? Do we floss or do we brush first? People have different opinions. To me, I like to do it the way I clean. Like for instance, you know, a lot of you are moms or dads and you have children and they have toys on the ground. What do you do first? You vacuum or you pick up the big toys? So when you are going to clean your teeth, what I like to do is first get rid of the bigger stuff, and that's what gets caught in between our teeth. So for that, what I do is I use floss. Now, you can use tape, you can use regular floss, but I would advise you to start with wax. And I not only started with wax, but I stayed with wax floss. There are several brands. I particularly love Johnson & Johnson and Glide. One tends to be more expensive than the other, so it's up to you of which one you want to buy. It depends on everybody's pocket, right? So how long should I use the floss, the piece of floss that I get? So this is about as big as I get my floss. Okay, we're not gonna be doing any jumping rope, so we don't need anything bigger than this. What we're going to do is we're going to roll it in our middle finger, and we're going to do the same thing on our other middle finger, to the point in which we have about this much difference, you know, space in between it. And you see I have both my index fingers and my thumbs right here. So I like to do this always in a sequence, the way I know, even if I am interrupted by one of my kids or my husband, where I started and where I am ending. So I like to start in the upper right, go to the upper left, then come down and finish all my lower right. And I've done this for years, and that's how I got used to it. So if something happens and they call me, I know where I was, and then I can just continue. And finish up. You know how those emergencies that the children have. But anyway, so I am not going to show you all the way in the back. I can show you how I place it, but I am not going to show you because it's going to be hard for you to see. So when I go all the way to the back, I'm going to do it like this. As you can see, I'm pushing with my index and then on my thumb, having control there. But I'm going to show you right here, which is easier. So you're going to go in, embrace the tooth, and then come back and forth, you know, and down. And then on the same embrasure, you're gonna do the same thing. And then the tooth in the front, you embrace the tooth in the front, and then you go down. And you keep on going like this all the way, and then you come back, and the back again. Yes. You don't need to push hard. If you don't hold your floss like this, what happens is that then you jam it in and then you cut yourself and you're like, oh no, I really don't like it. But with this, you have a lot of control and you're able to do it properly. Once you're done flossing, what you're going to do is you're going to use your toothbrush. Now, people ask me, should I use my regular toothbrush? Should I use an ultrasonic toothbrush, you know. So for me, I have to tell you, and I have to be honest, I have been using Sonicare forever. I don't get a kickback from them. I am not doing any any promotions. This is what we offer to our patients at our office, and this is what we use at home, every single one of us. So I love it. It has the attachments that you can have like different heads. So you know, you can use it for your husband and yourself, if you're just by yourself with your kids, or you can buy one for, you know, for the 2 kids or 3 kids, whatever, and they can just have each one their attachment. It also has an attachment for a tongue cleaner, which is this. I honestly, like, as much as I love the brush, I don't like the tongue cleaner. I don't feel that it does as good job as the brushes do. So for my tongue, what I use a tongue scraper, and this is my old tongue scraper, and I just think it's fantastic. So a lot of people have never cleaned their tongue, and that is something that is quite surprising, but it's true. We're taught to brush, but not really to floss and not really to scrape our tongues. And if you think about it, you know, your tongue has a lot of like this taste buds, and it looks kind of like a carpet. So imagine if you spill soup on carpet, and then how do you clean it, right? So you really have to go in and brush it well, and rinse it properly. So that's what you want to do with your tongue. Otherwise, that food that gets collected in there tends to go bad and smells bad, and that's a lot of the cases for bad breath. So how do we use the brush, right? So let's say this one already has this. Many of you have come and told me at one point I have sensitive teeth, and then when we observe that there is like receding gum, the gum is like pulling away from the tooth, or you are just making these notches in the teeth because you're going too hard at it. So the technique is really important, okay? And so I'm gonna use this this fake teeth, so it's easier to show you. And you're gonna go in your mouth like this, but you're gonna put it on your the bristles are gonna go here like this, so half on the gum part and half on the tooth. And once it's in your mouth, you are going to start the brush, and you are going to go in like this and just move it along. You know, you can do a little bit of a circular motion, but you're just gonna move it along. And the ultrasonic causes a lot of bubbles that go in between the teeth, which is fantastic. And remember, we already floss, so those areas are clean. You see how it's like foam forming right there, and we don't have much water on the toothbrush at all. How much should we use of toothpaste? So what I do is I just use a pea size of toothpaste. I don't like to like fill my whole bristles with toothpaste. It's just too much, and it just gets really, really messy. So just that's enough, about a pea size of toothpaste, and you just go around. Once you get to the middle, what you're gonna do is you're going to turn the other way and keep on going, always in an angle. So it's not gonna go like this, and you're not going back and forth. What you're doing is you're just pushing the bristles, you know, a little bit against the arm. Now, when do you know how much pressure to put? This is the beauty of this brush. So I'm gonna show you in my mouth, when I put too much pressure, the light is going to go off, and you're gonna be able to see. This is normal. And now look. See, it alerts me that I am pushing too hard, and I might be causing damage either to my enamel, or like the outer layer of my teeth, or the gum area. So that is the technique. So you go again, I start on the right and go all the way to the center, then I flip, and then I go like this. Now remember, this is what we can see, but there are teeth surfaces on the other side. So you go in and go around, and then like this, and then the part that you chew with, like that, you know. So you have to do the part that touches the cheek, the part that's inside that touches your tongue, the back of the teeth, and then the area that you bite with, which would be this, the occlusal part, okay? That you bite with, and you come, again, you just push it forward from the back towards the front. And then comes the tongue part, right? So for the people that do like the tongue cleaner, you can change the attachment and just use the tongue, and it will just kind of vibrate in your tongue. I really don't like it very much. What I like is to use my tongue scraper. You just place it inside your mouth, push against your tongue, and scrape down. So let's say if this is my tongue, I'm gonna go in, push a little bit down, not too much pressure, just enough, and then you just pull forward. And that is going to take all that debris, whatever food residue that might be on your tongue area. After that, you can use any mouth rinse that you would like, you know, Listerine or whatnot, that would help with your breath. This is basically what I do at home. How many times do I brush? You have to brush every time you eat. Just like you wash your dishes every time you eat, you brush your teeth every time you eat. Otherwise, you're like eating on a dirty plate, right? The next time. So make sure that you brush every time you eat, that you never go to bed without brushing your teeth. That's really important. And that is the path to really great oral health. However, don't forget, there are many things that we can't see. And just because something doesn't hurt doesn't mean that nothing is wrong. So we want to make sure that we keep up with our semi-annual checkups. So make sure that you make your appointment, that you get to be seen, that we get to take x-rays in between your teeth and see that if there is anything going on, like a new cavity forming, God forbid, but it could be. Sometimes a lot of people now are eating nuts, a lot of almonds and stuff, and then they bite and their teeth crack. And if, you know, it's like if you see a crack on your windshield, right, and you just leave it there, what is going to happen is just going to keep on cracking until it breaks. So it is not safe to just leave it like that. So you want to be able to make sure that a professional is also checking, you know, with x-rays and with my own eyes. And I use loupes for the people that come to my office. They always see me with these loupes that allow me to see your teeth this big, and also to do your oral cancer screening, that is so important to do annually. So good news, now we are able to do some teledentistry, and I'm going to put right on the top or the bottom, I don't know how it's going to end up, but we're going to have there a link where you can actually click and make an appointment, and we can have a one-on-one, have our appointment through Zoom. So if you need some advice and you want to have an actual, consultation with me, you are free to do that. Otherwise, you can just leave me a message, and I can answer you through text. But if you actually want to have a one-on-one and be able to talk to me and show me some things through your phone or computer, I am available through Zoom, and you just have to make an appointment through Calendly. I look forward to seeing all of you. I want to make sure that everybody's keeping up with their health. And also my office is going to be calling you guys pretty soon to schedule your appointments. That way we are able to get you back in track and get healthy for the rest of the year. It was great seeing you again. Bye-bye.